Okay, let's go ahead and get started. I want to welcome everybody here today in the series of COVID-19 webinars that we've been having on Thursdays. We've seen a lot of issues over the last few weeks, and you have too, just in terms of almost every program that COVID has affected for persons with disabilities in education and employment, in community living, all areas that are making things that do make things more difficult for individuals with disabilities, and in some cases even dangerous for folks with disabilities because of the COVID pandemic. And today we're lucky to have Justice Shorter, who is the Disaster Protection Advisor with NDRN, which of course is the National Disability Rights Network. She supports the protection and advocacy system with technical assistance and trainings related to disaster protections, emergency management, fire safety, and humanitarian crises and conflicts. And she's also served a more recent, in the past, as the Disability Integration Advisor with the U.S. Federal Emergency Management Agency. And we really appreciate her being here today to talk about some of the issues that NDRN and some of the protection and advocacy programs in the states see as a result of the COVID virus. So with that, I'm going to go ahead and turn it over to you, Justice.
Thank you, Marty. I appreciate that. Good afternoon, everyone. As Marty mentioned, my name is Justice Shorter. I am the Disaster Protection Advisor at the National Disability Rights Network, which means that my entire purpose is to support America's protection and advocacy system with any issues related to disasters, fires, humanitarian crises, or other types of emergencies, which now include health pandemics. I just wanted to make a quick note here in terms of an accommodation request that I ask of you all. I do use a screen reader, which means that I will occasionally pause throughout today's presentation. So please don't think that it's any issue with your connection or that something is wrong, but there will be a slight delay so that I can make sure that what I'm saying is in sync with what you're saying. And you'll also hear me providing verbal cues for us to transition in between slides so that you all can follow along with me as I go. Today's session will be a little bit fluid. I'm going to go over some of the overarching issues that we're seeing from protection and advocacy agencies, as well as some of our partner organizations from around the country. And then we'll drill down a bit on the AT perspective and really engage you all in a more robust discussion. So I truly hope that you folks will be ready to engage and converse about how we can work together and collaborate more cohesively in our collective response to the coronavirus pandemic. So do not be shy. And as we're going along, please feel free to think through some of the questions or discussion points. As I mentioned, I'll just go over some of the big issues. So I'm not going to spend a ton of time on this. We're going to maybe spend about 20 or so minutes talking through some of these issues, and then we're going to swing it over to the larger part of today's session, which is conversations with you all and having you kind of drive the rest of the session. So I hope that you all are willing to participate and engage with me today. All right, next slide. All right, so as Marty mentioned, this pandemic is impacting every single program area, and I'm sure you all have noticed it. We have certainly noticed it at NDRN, and I'll go through some of those program areas now. We see this in relation to education, specifically in relation to the Individuals with Disabilities Education Act, IDEA. There has been some proposals to try to waive some of the provisions in IDEA, given that many students are out of school and some school districts are trying to discern whether or not they have to provide equitable access to education for students who are in special needs courses. And special education courses, and of course the larger disability community is pushing back towards any dissolving of disability rights on any scale, and that of course is inclusive of the way that we educate our children. And so we see this happening here, but you know, the underlying message here is that the rights of children with disabilities need to be upheld, and that if distance learning is taking place, if pamphlets and packets are being provided, then that also needs to be done in a way that is equally accessible to students with disabilities. And so you see a lot of folks across the country trying to work with school districts and parents and teachers independently to give them additional advice and insights on how they can continue to engage in a meaningful way rather than just the illusion of inclusion, right? Kind of saying, you know, we'll check in on you or just check out this app, but not having that be a real form of engaging students with disability in a way that really progresses their learning. We see this in terms of criminal justice. So I'm sure some of you have maybe seen the news stories about uprisings in prisons. A lot has been going on in Mississippi, I think Kansas, a couple of other places where prisoners have been protesting conditions inside jails. When there is a disaster or pandemic or emergency of any scale, you see issues just amplified. So issues that are already prevalent or present in everyday normal situations are just exacerbated during a disaster. And that's what you see here. So if prisoners don't have access to clean water or water being available on a consistent basis, access to soap, access to accommodations other than those that are being provided by other prisoners, then it puts them in a very precarious position in regards to how they can safely remain hygienic, and then also socially isolate. And you know, so all of these things are things that folks are thinking through as well. And this is also true in terms of ICE detention centers. You know, what does that mean in terms of folks in those facilities that have disabilities? Who do not have access to accommodations, because again, if many of those accommodations were being provided through other inmates or other, you know, individuals who were in the prison, and now you have to isolate, what does that then mean for you? But then also, again, if you have contracted the virus, you know, having access to healthcare, but also trying to keep yourself safe. So we've just been hearing about the virus really flowing like wildfire through some of the prisons across the country, and so it's a high area of concern. Voting has also appeared as an issue, trying to make sure that people still have equal access to the ballot. We saw this most recently in my home state of Wisconsin. I'm a Milwaukee girl, born and raised, but we saw this issue come up where it had gone from about 180 or so polling places to around 5 just in Milwaukee alone, and that option, you know, still being provided for people to have in-person voting, but how dangerous a lot of folks felt as if that was in terms of what's going on with the coronavirus pandemic, and so many people calling for there to be a postponement of the primary, similarly to what's being done in other states across the country. But there was just such a political rift that took place there, and suspicions of voter suppression and just a number of other things. But folks, you know, often think about this, and our voting rights expert will say this quite often. Sometimes the ADA and disability rights will be used as a convenient excuse as to why certain decisions are being made, but overall it just continues to suppress the vote and continues to disadvantage a lot of communities, particularly historically marginalized communities. And so we just see that happening here when the coronavirus just again continues to amplify some of those issues, right, of people still not having access to the vote because although some of those places are open, you know, still not wanting to go in and still maybe not being able to receive the assistance needed. This is also true when we think about transportation. Some of the issues that we see arise with people not having access to drive-through testing sites. I just had a conversation with the legal director of the Connecticut PNA yesterday, and we're trying to delve a little bit deeper into what's going on with their drive-through testing sites and whether, you know, what is the levels of inaccessibility there in terms of whether it's physically inaccessible, for example, paratransit vehicles, are they not able to get through, or is it programmatic? In the sense that accommodations are not being provided and information or communication access is not being provided. So, you know, are people being able to have access to interpreters, have access to additional resources and information in alternative formats, just all of these different things we want more information about. And hospitals right now are just in a fury of trying to figure everything out, and kind of everything is kind of fluttering around in different ways, and it's being done in kind of an ad hoc way of providing accommodations, which in certain circumstances you can understand in a disaster. However, there are things that can be done. There's guidance, there's recommendations that come from, you know, different groups such as Northwest ADA Center, and some of these things have been out for a bit of time now, just these recommendations and guidance on how some of these facilities can be made accessible. So it's not as if people need to reinvent the wheel. We do, however, need individuals to be willing participants to make some of these adjustments to assure that folks still have convenient and rapid ways of receiving testing and treatment during the pandemic. Next slide. All right, housing, this is also an issue. Texas has given us good information around renters' rights. We just have been hearing certain things about people receiving misinformation, like just related to their rights, and landlords asking for certain information related to people's health, and pretty much telling folks that they can't leave their homes and can't, to even access, some of the basic necessities that they need. And so we put out a Know Your Rights campaign series that we actually just rolled out this week to try to get at some of the misinformation that's been out there around people's rights to a number of issues. The housing was the issue that we focused on just yesterday. And it also spoke about just some of the benefits and the options that are also now being made available through certain legislative actions such as the CARES Act. Mental health, and so I mentioned here in mental health, I mentioned on the slide here kind of accessible crisis counseling, so making sure that crisis counseling lines also have individuals who have a competency in disability, right? So being able to understand some of the nuance and some of the compounded challenges that people are dealing with as in the intersection of disability and poverty, or disability and transgender issues, the disability and race issues, but really having a more nuanced understanding of how all of those issues can have a significant impact on someone's mental health. And so sometimes that is absent in the counselors that are made available through these main hotlines, and just overall accessibility of the hotlines for individuals who have certain communication needs, right? So individuals who are deaf, individuals who are deaf-blind, but making sure that there are continued avenues for people to equitably be able to access these lines, especially since right now crisis counseling is the only program that's being offered through FEMA's Individual Assistance Program, right? So it's being offered nationwide, and so we just want folks to just be aware that that's an issue. But I also just want to bring up here that something that was brought to my attention most recently by an advocate in terms of mental health, and that's the concern that people's psychiatric disabilities will prevent adequate and inaccurate physical diagnosis, right? And in terms of what their concerns are around the coronavirus. And so we've seen that historically happen to people with different psychiatric disabilities. Their concerns about their physical health being dismissed or disregarded or thought to be a delusion, and how that could put people at a higher risk of perhaps contracting the virus or not having access to care. I will also mention here community integration. Making sure that people who are receiving home and community-based services do so consistently. We're hearing multiple stories about disruption in services or delays, and individuals not having access to their direct service providers, folks not being able to get through and assist when individuals go into hospitals. Certain hospitals may not provide certain types of care, such as feeding or changing or just dressing or some other things. I mean, depending on what type of hospital you're in, and the capacity of staff, we just see that there are some lags and delays there. And so having access to care providers is certainly your personal care attendants and providers when you're in that setting, as well as when you're at home, is also an issue. We also see a lot of murmurings right now in terms of the 1135 Medicaid waivers, and the misuse of these waivers can result in individuals being unnecessarily institutionalized, right? So there's a provision in this waiver that gives states the options to choose alternative settings for people to receive care, as opposed to them receiving care in their primary setting prior to the disaster. And the disadvantages of this is that individuals can end up in a nursing home setting or an institutional setting and not have a pathway for getting back out. And sometimes there could be long-term residual implications of such a move. And so having provisions in place of how people are going to be discharged, and then hopefully, ideally, preventing people from even going into these settings in the first place, given how much the virus has spread in these areas and in these settings, I think is also a priority for most people and involved in this work. And we'll go on to the next slide here. The next slide here is a map of medical rationing, and this really just shows P&A activities, the protection and advocacy agencies, their activities related to this issue of medical rationing. So all of the states in red are states that have filed a complaint with the Department of Health and Human Services Office of Civil Rights. And they are filing these complaints in direct response to some of these crisis standards of care or pandemic plans that have been released by their states. And so this started off with Washington and was followed through by Alabama and Tennessee and Kansas and Pennsylvania and several others who filed complaints arguing that these crisis standards of care disproportionately discriminated against individuals with disabilities by having certain provisions in there that explicitly, in some cases, mention that if you have an intellectual developmental disability, that would be weighed in the decision to provide you with care or critical resources such as a ventilator. In other cases, them weighing comorbidities, morbidities, which may look to people's pre-existing healthcare conditions that may not necessarily be life-threatening, but when coupled with the coronavirus could cause a healthcare provider or a physician to make the very fatal decision of not providing someone with very crucial and precious resources there. So this really leads to this conversation about the devaluation and the dehumanization of individuals with disabilities. And so you have people who are within the P&As, attorneys within the protection and advocacy agencies, as well as several other partners. The ARC has been involved with this, as well as the Center for Public Representation and several others to try to push this forward. We saw a wonderful result in Alabama where they rescinded the guidance that they initially put out, and we're hoping for similar change to happen across the country. In direct response to some of the complaints that were filed, HHS actually released a bulletin that said in no way should civil rights be dismissed and should people with disabilities be discriminated against, so on and so forth. The states you see in blue are states where protection and advocacy agencies have written letters to government officials, so that includes health commissioners and HHS secretaries for their state. It includes governors, lieutenant governors, business leaders, hospitals, all ranges of things. I mean, I had a letter just come in yesterday for someone who was advocating for individuals who receive lupus medication, because there has been some misinformation that lupus medications, the same medications used to treat lupus, can also be used to cure the coronavirus. And so that medication is now there's now a shortage, and people who have lupus are not being able to access their medication. So advocating for stronger awareness and oversight from these government entities to make sure that people who actually have these diseases can still retain access to care. The states you see in purple are just states who have done both of those things. They have both provided complaints as well as have been submitting letters to just a whole range of officials advocating on behalf of people with disabilities in a number of ways, but again, all related to the legally based rights of individuals with disabilities. So it's a very active list, and I can very well guarantee you that that is not complete. We're updating it almost daily or weekly, and we're hearing different updates consistently of states who are just engaging in a number of very creative ways, and we can get into a ton of that directly after this. Next slide here. So I also, yeah, sure.
We had one question. Somebody had asked about the source of the map, and will it be someplace on the NDRN website by any chance as it's updated?
It is on NDRN's public website, and that is a map that we created, so it's not sourced from anybody else. It's just a map that was created internally, and it should be up on NDRN's COVID-19 issues page. So if you go to NDRN's website and you check out the little drop-down menu that has all of the different pages and options and issue areas, there should be a COVID-19 page where you can find it. And if you can't, let me know and I'll figure it out. And make sure I give you the right information on the follow-up through Marty. Absolutely.
Thank you.
All right. And so now we're on the slide that you all should be seeing that says communities of color. And I wanted to emphasize this because if you all have been watching the news at all, you are noticing that states are just now starting to release data, specifically data that is disaggregated by race. And how communities of color are being disproportionately impacted by this virus, which makes me drill down on people of color with disabilities who are being disproportionately impacted by this disaster or by this pandemic. And so you just see this happening in a number of ways. Black Indigenous people of color is specifically what I'm focused on here because you see this happening in Virginia where it's almost double the rate of infections and contractions of coronavirus within the Black community. You see it in Louisiana where it's around 70 or 80% last time I checked. The same is true for just outsized numbers in Illinois and Michigan and New York and sadly in my home state and city of Milwaukee, Wisconsin. In the very beginning, Milwaukee, there was only deaths of Black people being recorded. And then after, I think, almost a dozen or so, then we saw other races being reflected. But the first several deaths there were within the Black community. And so we just see that happening as a result of several long-standing historical health inequities in terms of people not having access to health care, in terms of some of the most essential workers being people of color and people who are in the service industry, so not having the capacity to socially distance. And, you know, it's been framed in very relatable words here in terms of that people do not have the privilege of just socially distancing in many cases. You see this in terms of multi-generational households where it's not as easy to socially distance, but then also you may have people who have multiple underlying conditions that just make them far more susceptible to contracting the disease, who live with loved ones who must go out and work and don't have the ability to socially distance, and that putting them at an even greater risk. And also not perhaps having a home where you can go into the basement, having a finished basement, right? What that means to have like a fully, stocked or fully finished basement or an attic or wing or multiple rooms in your home where you can go and fully isolate yourself. That option is not available to everyone. And there's several other issues, some of which we actually get into. I mentioned this before that NDRN has this Know Your Rights campaign that we launched this week. The first video was on transportation. Yesterday's video was on housing. Today, we were supposed to release our health inequities video, but it's probably going to come out tomorrow. And the attorney that we have speaking there is specifically getting at the issues regarding longstanding health inequities within the Black community and just constantly reemphasizing that people deserve the right to health care. And I can get into many of the issues concerning the Black community in particular during the discussion hour. But then I also had a conversation yesterday with the executive director of our Native American PNAs, the PNA that services the Four Corners region of the Pacific Southwest. And she mentioned how this is really spreading very quickly throughout the Navajo Nation, and how not having access to healthcare, running water, and just some of the power dynamics there really also help to exacerbate this problem within the Native populations. And so we're going to also do a video where they kind of speak to some of those issues as well. And so that's what I mean when I say access to water, healthcare, reliable internet connection, because a lot of things are happening right now via telehealth. And as we very well know, you have to be able to connect to access telehealth, and you need to be able to have access to not only access to internet, but you need to know that those resources are available and how to use them and so on and so forth. So it's definitely appeared as a problem in communities that already did not have access to resources in such a way, again, just exacerbating the problem even more. Okay, and so now we're going to move on to the next slide. And this is the last slide I'll cover before we just go straight into discussion. Marty asked me to just touch base with a few of my colleagues from the National Disability Rights Network just to highlight some of the AT specific issues. Now, many of which I spoke about within this, last 15 or so minutes, but I'll just weave in a couple of more. The AT evaluations, there's really been a lot of delays in getting people evaluated for, what type of assistive technology they're eligible for or that can be provided. So there's been some delays there that comes to us by way of our lead on employment and vocational rehabilitation services. She also mentions that sometimes the communication right now has been very unreliable in terms of people connecting with vocational rehabilitation counselors who are working remotely. More broadly, the question typically comes up about interpreting services, and I mentioned this before, but I also just want to continue to emphasize this. At hospital settings, we've received information right now and requests for legal assistance from folks who are showing up to hospitals and are especially deaf folks and who are not having access, communication access, and so are receiving all types of delays in care, testing, and treatment because they can't fully communicate with the healthcare staff there and thus appropriately advocate for themselves in terms of what they need. We see here a problem with there not being enough support staff to assist with different distance learning. So school districts not having enough support staff to help with some of those just technological issues involving distance learning and helping parents get their kids online or have alternative ways of accessing that information and to make it available to their children. Not having computers is another major issue. So not every school district can give their kids a computer. Not every school individual freestanding school has the capacity or has school or computers readily available to rapidly distribute to their entire student body population. This is the case in more affluent schools, but that is certainly not the case in all schools. And I'm not saying that some of the schools in urban areas don't have this, because they certainly do. But not all of them have that, right? So when we're just talking about equitable access across the board for students to be able to participate in educational processes and curriculums, not having access to computers is definitely an issue. I mentioned this already, but also I'll just end here with the lack of access to broadband services to fully sustain, several hours online. Some people may have data plans to be able to do hotspots and things like that, but it is not unlimited. So the ability to do that for, 8 hours a day, 5 days a week is very difficult when your wife or your husband is also queued in for teleworking or so on and so forth. So, or when you have multiple kids who are also trying to, pull in on kind of that one access point to be able to do their work while at home. But we heard, a good story that came out of Arizona, where I think it was Arizona State University had tried or is trying right now to make mobile hotspots more readily available for people in rural communities who, again, already didn't have access to reliable internet services, but trying to make that an option for them. So hopefully this is also happening in many more places across the country where schools, universities, private entities are trying to make broadband services more available. We've also seen this through Lifeline. This is a cell phone option for individuals to also be able to tap into during the coronavirus pandemic. It was already in place before this, but sometimes people refer to them as the Obama phones or so on and so forth. But making sure that people can use those phones during the pandemic and have access to extended data has been something that has been underway right now. And I think there was a successful outcome in advocating that come to the forefront in recent weeks. So those are my main updates. And now we can go on to the next slide because I'm ready to discuss. Again, I just provided just some basic overviews, a real panoramic perspective of some of the overarching issues that are currently at the forefront or top priority in programmatic items. But I am far more interested in speaking to all of you about some of the more detailed questions that you may have, or any advice and information that you may have with regards to how we can all work together more collectively and cohesively. So I'm going to pass it back over to Marty, who I think will help facilitate this discussion portion of today's session.
Yeah, go ahead and go on to the next slide. So one of the things that we were talking about that Justice and wanted to find out a little bit about, just in terms of what are you seeing? Some of the things that she talked about are the same exact things that we've been talking about in the last weeks, but just issues. Some of those are just issues in how state and local governments are sharing information in accessible format, any problems with public accommodations with grocery stores or pharmacies or restaurants, providing goods and services in an accessible manner. Problem with students, of course, getting the AT and accessible platforms they need, whether it's elementary and secondary schools or colleges and universities. And then the next slide. Yeah, just obviously issues with employment, both for people that already had employment and had to move to a teleworking atmosphere, or for folks who are seeking or will be seeking vocational rehabilitation services, either for employment or for transition services. And then just challenges with AT devices and also services in long-term care settings, not just in skilled nursing facilities, but also in community services, either getting AT or devices through their Medicaid state plan or through home and community-based services. And then also, of course, issues related to captioning and interpreter services. So I didn't know if you had any specific questions that you wanted to share or ask about, Justine, but if anybody has anything that they would like to share, questions, or if they can either put it in the chat box or raise their hand and we'll open up their mics.
Marty, in the chat box, this is Amy Goldman, your chat box moderator for today. We did hear from Denise that our state has canceled all uses of Zoom, which is our best bet for captioning and accessibility. So kind of not surprising given all the bad press Zoom got last week, even though some of those securities loopholes have been closed by Zoom. Plus, I think end users have become more aware. So definitely a challenge when probably one of the most accessible platforms is now forbidden. Angela from Texas says, our university has also locked down what we could do. The digital divide, K-12 is a challenge because of not having home computers for everybody or internet plans. And this is sort of familiar when you have mom, dad, and maybe 3 siblings all trying to access online. So I don't know if you've got comments on those, and then I'll proceed to some other comments that have come in.
Hey there, this is Justice. So the first thing is, if your state is shutting down Zoom, I would really challenge them to provide another accessible alternative. So if it's not going to be Zoom, then what is it going to be? And maybe asking for that provision or that new policy to be lifted as it relates to providing access to students with disabilities or providing access to individuals with disabilities who need an accessible way of connecting, but asking that that be a reasonable accommodation, that particular ban be lifted. Just in terms of your advocacy apparatus, I think that could possibly be included within that. But then also, making it, very clear that, hey, we understand the risk. And I think somebody also told me, and you all will know this better than I do because I'm not on Skype that often, but I've been told that Skype has also started to make their platform a bit more accessible in terms of captioning. How good is that? If anybody knows, please let me know, because I've been told various things, that sometimes it's not great and sometimes it has been helpful. So if there anyone who has a comment on that, that would be great. I think the second statement that was made there, absolutely, that's something that I alluded to on that very last slide, right? Everybody's trying to connect on maybe the same or a singular device, and that being a very difficult thing to do in a household when everybody is there. I'll also just point out one thing, because this is an interesting point, and we're trying to, well, we will include this in our Know Your Rights series as well, but the fact that everybody is at home is not always a good thing for everybody. And I did not bring this up on the every program area, but I forgot to put it up there, but another issue here is abuse, neglect, and domestic violence. And on average, anecdotally, because it's not been tracked sufficiently in a quantitative way, but anecdotally, we see that domestic violence numbers tend to rise after a disaster, given the heightened levels of distress and trauma, and people, there being kind of a lot of economic strain on households. And we see this already happening and proliferating a lot globally. We see that reports are coming out about domestic violence being on the rise in different parts of the world. But then we've also seen a sprinkling of these numbers coming through in the United States. Texas has seen certain police stations in Texas has seen almost a doubling in domestic violence numbers. And the same is true for, I think, Washington State has also seen a couple of rises there in terms of domestic violence numbers. And that's just very important to emphasize, because sometimes people are trapped with their abusers. And this is also true in terms of caregiver violence. And so we have a couple videos coming out related to that as well. So just wanted to throw that in there, because as I thought about everybody being at home at once, it immediately triggered this other issue that we're trying to face in terms of abuse, neglect, and exploitation. And I'll let you all continue with more comments, hopefully.
So this is Amy again, and Justice will be sure to send you an invitation in a couple of weeks. We're having a webinar on captioning. So
hey, there we go.
we've got some in-house experts, and John Brandt from Maine will be presenting for us. On a slightly different note, Danny Hasley from Georgia wrote that one of our biggest problems for Georgia will be drive-through testing. Our paratransit service in Atlanta requires 1 hour between trips. There is no waiting. This greatly exposes us, and there's been no guidance from MARTA on this. They did recently announce only 2 people will be allowed on paratransit buses now, but didn't relay how this would impact on the use of attendants.
Yeah, and this is the exact same issue that I am trying to garner more attention around. It's not, first off, paratransit services are extremely sluggish in the best of circumstances. But then when you couple that with the inability to get to a drive-through or a mobile testing site and have to, wait and be exposed to, potentially several sick people. And, the difficulty is there has not been comparable alternatives for individuals who do not have vehicles that is just, as I mentioned before, just as convenient and just as rapid and just as fluid as the general population who does drive has access to. So the alternative can't just be, we'll come sit in our waiting room, in our emergency, room, just come sit in the waiting area, and then when we'll get to you. The whole idea around drive-through testing is that you limit your risk of exposure. And so unless there is a comparable process or system put in place for individuals with disabilities, it's a real problem, and it's not accessible. So there's 2 issues, at the core here. One, what does this mean in terms of paratransit services? I'm really trying to rally around a real push to make paratransit departments say it plain in terms of what this means for people who need access, because for people who don't have transportation, in many cases, the only options are paratransit or an ambulance. There's not a lot of in between there. Some folks may say, well, just use Uber and Lyft, but that, there's a whole other host of problems in terms of that as well. And this whole social distancing, people not wanting to touch you, not having accessible vehicles available, whole other range of issues that we get into there. So it's not just as easy as tapping an app and just getting a ride to show up at your door, especially if you're sick or you're concerned about being sick. So it's that whole idea of making sure that the rights of people with disabilities are not being dismissed or disregarded or diluted in terms of how states are setting up their testing and their treatment plans for an entire city or an entire state, they must also make the same amount of effort to do so in a way that's going to be equitably available for individuals with disabilities. And that's what we're pushing for. So I highly encourage you to push for this as well in whatever capacity you can.
So, Justice, this is actually hot off the presses as of today.
All right.
OCR has resolved civil rights complaint against Pennsylvania.
Hey now, all right now, hey, that makes me happy. That was very recent. Pennsylvania just filed that complaint like not too long ago. So we are seeing results, folks. It is slow, but we are seeing it. We're happy to have seen it in Alabama, seeing it again now here in Pennsylvania, and we're hoping to just stack them up and make them fall like dominoes in terms of discrimination, just make discrimination fall like dominoes. We don't want people with disabilities to be disadvantaged or to wait until it comes down to the decision of a person with a disability and someone who is without a disability, who perhaps is younger, who perhaps is not a person of color, to have that decision happen in such a crucial moment. We want to get out ahead of this, which is why these complaints were filed as soon as some of this these guidances were released. So that just made my day. That was a cherry on top of my afternoon. Thank you for that.
Yeah, so Pennsylvania Department of Health revised its standard of care guidelines by removing criteria that automatically deprioritize persons on the basis of particular disabilities, require individualized assessments based on the best available, relevant, and objective medical evidence to support triaging decisions, and ensuring that no one is denied care based on stereotypes, assessments of quality of life, or judgments about a person's worth based on the presence or absence of disabilities. So thanks to our friends at Pennsylvania Disability Rights, and for all the work of NDRN and its affiliates across the country.
I just want to make a quick note on that, that just very, very quickly, is that the comorbidities issue is these underlying issues are also affecting communities of color in the very, very same way. And I mentioned this in earlier, but, you know, saying the stereotypes piece that was mentioned there, that, oh, it's just because it's your diabetes that's flaring up, it's just the fact that you have asthma, or it's just hypertension, that's really what's wrong. And not giving people access to testing is another critical issue that we're seeing. If I can personalize this for just a moment, my sister contracted the virus but could not get a test, and she was only having access to a healthcare provider via telehealth options because they discouraged her from coming in. And she's a Black woman, been a Black woman all her life, along with my mother, and my mother had to really, really push her and advocate that she go into the hospital. And once she did, she found out that she had the virus as well as pneumonia. And that was something that was not going to be forthcoming via telehealth, but it's also something that Black women, Black people in general, people of color see consistently in terms of their concerns being dismissed or not taken as seriously, or immediately thought to be other healthcare conditions that are not related to this virus. And that puts us at a significant disadvantage and greater exposure to contracting this. Had she not gone in, that pneumonia would have certainly gotten worse, and it could have led to a lot of more detrimental circumstances. So I just personalized it a little bit. Back to you, Amy.
Okay. We did have Scott wondering if some states are seeing a reduction in calls from people with disabilities themselves. So maybe, Justin, you can address that in terms of NDRN, and maybe some of our state programs can react as well.
A reduction in calls, how so? Like for what type of assistance, in AT, or just assistance overall, or what types of calls? There's several different types.
Why don't you
in
address
general?
assistance overall, just in terms of calls that maybe are coming into the PMAs?
Yeah, so I think right now with this Know Your Rights series that we're doing, I actually think they're going to see an influx, because just because we don't hear things don't mean it's not happening, right? And a lot of times people don't know when to come to you for certain things. So if you're not expressly promoting or providing information that lets people know, hey, this is the unique ways that this situation has arisen as a result of the pandemic, then you won't see those numbers. You maybe won't be able to truly grasp the impact until afterwards. We are actually preparing for a very long and intense and increased level of involvement with regards to the complaints, the lawsuits, the concerns, and the challenges that are going to be raised once things start to calm down a little bit, once people regain access to their support systems, once people are able to come back into centers, and once some of their most critical needs have been met, dealing with some of those systemic issues. So I by no means judge maybe a lull in calls to equate to there being kind of a non-existence of some of those key issues that we deal with heavily on a day-to-day basis, but that certainly will be emerging throughout the pandemic.
Great. And Scott added that he thinks outreach is key. I guess letting people know what their rights are.
Yeah, I've been telling people, look, put up flyers, or, and do this digitally, send your information to places that are still open, because there are areas, rural areas, that do not have access to internet, but, people are still going into grocery stores, still going into pharmacies, calling out to those places. This is real creative grassroots type of stuff. But, talking to the store manager and saying, hey, you guys are in there every day. Can we just fax you our flyer? Can you just put it up on the front door to just let people know? The same is true when we're trying to reach domestic violence survivors or victims. Listen, this service is available to you if you have to go into these places anyway, because we know that we're isolated, but several of us are not completely isolated. We still have to go out and get medicine and water and food if we're not getting that delivered, right? Or if we don't have additional support coming in to help us do that. Some of us do have to go out and do that, or we have family members or support systems who are going out and doing those things. So if we can make that information right there and available to people as they're going out and still out and about, that's also important. But we're also trying to do our very best to connect with people as much as we can via social media. So if you all can amplify some of the messages in terms of rights that NDRN and several other groups are putting forth right now so that people can stay aware and stay informed, that would be tremendously helpful.
So what is the current status of threats to the provisions of IDEA and the protections thereof?
So there is, right now, Betsy DeBoss had a kind of 30 days or so. She had a specific period of time to consider waivers to the Individuals with Disabilities Education Act. It wasn't to completely dissolve, that civil right for children with disabilities, but it was to think through how students with disabilities could or could not, more specifically, be educated during the virus. So basically, or during the pandemic. So basically, letting school districts off the hook, so to speak, in terms of providing them with distance learning, packaged material. If you're providing that information or that content to the rest of the population, or what some school districts are doing is to say, well, we can't provide that information. We can't, do this the way we need to do to educate students with disabilities. So we're not going to provide it at all. So you can't say that we're providing it to general population students and not kids with disabilities and who are in special education courses. So in that sense, we're not going to provide anything. So that decision and those type of discussions have been underway for quite some time. And so folks have tried to get some clarity, but disability groups are pushing back on that extremely hard, especially given that some states right now are presuming that classes will be out for the rest of the year. And so what does that look like for students with developmental disabilities or who have autism or other types of disabilities where they have made tremendous progress due to routine and consistency and being able to kind of push forward on some of their educational plans, and having all of that be washed away because their parents don't have access to the material or any type of support on how to maintain that progress while the students are out. So that, effectively puts us up to maybe 2021, or maybe the fall of 2021. And what does that look like in terms of kind of a whole year or a year and a half of not having, any educational material or having a lack of educational material to really sustain some of the progress that's been made for a lot of students with disabilities? All of these are questions and concerns and that people have, and why they're challenging any sort of cut or scaling back of Individuals with Disabilities Education Act. But we will also be producing a Know Your Rights video around IDEA, which our Deputy Executive Director on Education, Ron Hager, will be doing, and that'll come out within the next couple of days here, and he'll just be speaking directly to parents of students with disabilities, explaining what all of this is, and he'll also be speaking to high school students and college students with disabilities in a separate video on how they can continue to advocate for their rights.
Yeah, it'll be interesting to see whether any compensatory ed cases arise.
Oh, yes.
Angela from Texas reminds us that ATIA, the Assistive Technology Industry Association, has a good free series about teaching students with more involved disabilities via distance.
Yeah, I think that's going to be the resources that you all have cannot be understated by any stretch in terms of your level of expertise and speciality and being able to connect with these school districts who are just going to the default option of, well, it can't be done. You know, it's difficult, so it just can't be done. And just automatically scaling back because it may be difficult or it may be time consuming. And we want to let folks know that that's not okay. Not okay. Just because something is difficult doesn't mean it's impossible. And having you all at the very front of that conversation, I think, is going to be key. So I'm sure you guys have already been inserting yourself into those conversations and directly corresponding and connecting with school districts. But please, you know, have conversations with principals and guidance counselors and, you know, sending out letters to these schools and universities, letting them know that, hey, I'm available. You know, we are available. Please make sure that students with disabilities are still receiving access. If you do not know, don't let that just be your excuse for doing nothing. It's not okay.
And I'll mention that.
Conversely, I was just going to say NDRN should feel free to refer any complaints to our state programs. Maria?
Absolutely. Absolutely. Yes. Ron is also actually he does the education, employment and AT is what he specializes in. So you better know it. Absolutely.
Yeah. And we definitely stay connected to Ron too. And I'll mention that one of the webinars in that ATI COVID series, I think it's next week, is on mental health, on technology and assistive technology involving mental health. So they're not all completely directed toward education. So that's one you might want to look at. I have a question for you.
That's very important. Sure.
Are you seeing anything as far as I know that the MFP has been extended as far as the funding through, I think it's through September. And there is a lot of AT available in some of the home and community-based waivers. Some of them are pretty broad, especially some of the DD home and community-based waivers and some of the aging waivers. But I'm just wondering, in terms of the way things are being delivered, I mean, are you seeing or hearing about people having trouble getting access to some of those home and community-based services?
Yeah, overall, there seems to be a lot of delays and disruptions in home and community-based services. As I mentioned in that last slide before we got into the discussion, the person who does a lot of work with rehab services and who just does a lot of work around AT as well, just more broadly, has mentioned that there's been a lot of delays in just getting people assessments, getting people cleared for, you know, the receiving AT, having conversations with counselors and getting assessments to figure out what exactly you need. All of those folks are working remotely as well. And there seems to just be a backlog there. You know, even with these waivers in place, they don't kind of magically make, you know, the durable medical equipment and consumable medical supplies just readily, you know, available at somebody's doorstep. You still kind of need to converse with the various people responsible for administering those programs to kind of hopefully get a clear and a rapid and a good response to your inquiry and your request. But I do not know more than that. I can, you know, continue to circle back, but that was kind of just the very most detailed information that I was able to get from my colleague who kind of specializes in this area. It's just, like I said, some of the information is not forthcoming at the moment, but I have every reason to believe that a lot of stories will emerge once this settles down as well.
And go ahead and move the slide down to Justice's contact information. So, and we will have the recording of this video available soon. We'll let people know when it's available. Any other questions that anybody wants to pose before we leave?
And I'm always just curious if there's people on the phone. I don't know if there's I always like to check the phone lines just in case, because I'm one of those folks who never uses the online platforms. I always call in via phone. So either way, if you all do have questions or even just discussion points, if you all want to talk about just different ways that we could work together better in terms of the advocacy, I can point out a few. You guys mentioned the drive-through issues. That's a problem. Please connect P&As around that. Gaining the education issue, major problem. This is a big way to connect with the P&As around that. We brought up the healthcare issues in terms of access to communication. A lot of that can also be done remotely through VRS and just a number of other ways, that Z5, all of these different apps and things that people are using to remain connected. Access to IRA, which is, video remote sighted assistance services that folks who are blind use, and you may not think that that would be necessarily relevant, but it is. If you are not able to receive sighted guides the way you usually would because people don't want to touch you or help you in that way, or if you are trying to read through some healthcare forms that someone has passed you and you are by yourself at a healthcare facility, you need to be able, or a hospital, you need to be able to maybe have somebody objectively read some of that information out or access some of the different apps. There's VoiceStream, just a number of different great apps, and I'm sure a lot of you know about these things. Or you can just take a picture, scan it very quickly, or as I mentioned, have a video remote sighted assistant kind of read through things for you in a more detailed way if you'd like. But all of that I think is really important to make sure that people can give informed consent as well. So there's just no shortage of ways that we can continue to engage and partner, especially on the state level.
Great, thank you. I'm not seeing other questions, so if you do have any other questions or anything you want to address with Justice directly, then you have her email address and phone number. And then we also have the NDRN website, and there was a link. The link to your COVID page is also in our chat box. So I want to thank you so much for being with us today. We really appreciate getting an update on everything that's happening and a lot of those issues that the NDRN is dealing with.
Absolutely. It's such a pleasure to be here. And I put my contact details on there, and I'm sincere about that. If you want to just talk through, just do some thought work, or you have some ideas or some concerns, do not hesitate to shoot me an email or give me a phone call, shoot me a text message. The number that I have listed there is my direct work cell, and I have it in my hand now. So if ever you want to text, call, or email to discuss any of these issues in greater depth, or to be connected to some, one of your P&As or some of the things that we're doing nationally, please do let us know. We would absolutely love to be engaged on an ongoing basis throughout the pandemic and beyond.
Yeah. Thanks again. Thank you so much. Thank you for everybody for attending, and we hope that you have a great day. We'll see you next time.
All right, bye-bye.